Jack Cornfield said of intensive spiritual practice that one doesn't take a journey into the Himalayas without a guide who knows the ancient paths. People sometimes refer to psychedelic guides and psychedelic sitters. There's a subtle differentiation. A sitter is someone who takes a more passive role. We might say that they're holding space for your psychedelic journey, looking after your safety, your bodily safety and such like. Whereas a psychedelic guide is someone who is more prepared to take more of a shepherding approach. They might be responsive to where you seem to be during your journey. They might notice a tear rolling down your face and be willing to check in with compassion and presence and provide that more directive, slightly directive, supportive care. It's easy to assume, as many people do, that you don't need a guide. Now, our research, our data, has linked having a guide, having someone that you feel you trust with you during a psychedelic journey, to better outcomes, both a more positive experience, but also to improvements in psychological well-being after your journey. So just be careful with that assumption that you know enough, perhaps, about psychedelics to not need a guide. So what to look for in a guide? Really, you want someone that you're comfortable with, that you trust. That seems to be a fundamental basic. Someone that you feel you can open up to. You know, even some of the most personal experience, if you can share that with your guide, then that's really important. Hopefully your guide is someone who embodies a sense of authenticity and presence, that they are truly listening. They're not scrolling on their phone or getting their laptop out, but they're there for you with that kind of loving attention. Another assumption you might hold is that anyone will do. They don't need to know the slightest thing about a psychedelic, that you just need to have someone with you. I would say that that's better than nothing. It is, but what I would add to that is it is better that if someone is coming into the role as a guide, that they watch this educational material so that they're better prepared for serving that role. It's ideal if your guide has had some personal experience with a psychedelic. I think it's possible theoretically that someone could serve that role if they have authenticity, they have the ability to deal well with crises, to remain calm and centered and present and level-headed. But it does serve a guide, I think, to have had personal experience, to know the terrain, like a Sherpa in the Himalayas. They've been there, they know the ancient paths. I do think it helps. Another ideal, if you can have two guides, it is a bonus. And what it gives you is the opportunity for one to leave the space, to use the bathroom, for example, and yet you have someone with you all the time holding space. So that is a bonus. It's how we do things in the research. We've tried it with one guide and found that actually two is quite a bit better. Another advantage of having two is if you're particularly sensitive, perhaps because of reasons of past trauma, to abandonment, if you're left by your one guide, that can be quite a frightening thing. So again, in having two, you can always feel anchored and supported, whatever the context. So the question of the gender of your guide is an interesting one that's worth saying some words about. It's a delicate one doesn't want to gender stereotype here, but let's think of some scenarios. I think the most important thing is that you feel that the gender is a good match. Perhaps you put some thought to the potential for projection, perhaps based on history of trauma, as to who your guide might be, a male or a female. Now, you might choose somebody very close to you as your guide, perhaps a loved one, a partner, your mother, father, whatever. Now that can work, but just ask yourself the question of whether you can be entirely open and honest with this individual. If it's really personal stuff, I don't know, material of a sexual nature, could you really share that material with a parent, for example? So perhaps sometimes it's useful to have someone who you know, who you trust, but is a kind of one step removed from somebody really close to you. It's important when choosing a guide and then preparing for the experience that, again, in that context of trust, you set some kind of ground rules, some boundaries for what's right and proper going into this journey. And one relevant and important point here relates to touch. Now, it can be very, very helpful and grounding to be touched during a psychedelic journey. But if you lay those ground rules ahead of the experience about what constitutes good and proper touch, then there's much less risk that touch can be misconstrued as romantic in gesture or even sexual. Just like therapy in general, but particularly with psychedelic therapy where people are going into a position of particular vulnerability, laying these ground rules ahead of time is really important. There's a classic dynamic to a kind of doctor-patient relationship that traditionally in the Western medical model is somewhat hierarchical. Doctor knows what's best and tells me what to do, and I, as passive patient, defer to their better knowledge. I would say in the context of psychedelic therapy, there's more of an equality of status. In a sense, the wisdom within a psychedelic journey is held more by the journeyer than the sober guide often. So that kind of equality of status, I think, is healthy when going into a psychedelic journey, and something for both the guide and the journeyer to be mindful of, that we're being present together in the world within this moment and this journey. There is this question of whether your guide should also be under the influence of a psychedelic, and certainly there are traditions like the ayahuasca tradition where a guide or a shaman is taking a small amount of the substance, and the thinking there is that they can be more in harmony and resonance with those who are taking bigger doses, and so perhaps be more responsive and more in that sort of state of consciousness. Now, I hear that, I understand that, but it's not something we do in the research context, and it's not typically something that's done in modern psychedelic therapy in the West. What's the best model? I don't think necessarily it's for me to say, but I would say that I think the safest model, particularly in this cultural context, is that your guide is sober. I just think in the interests of a bias towards caution and safety in this harm reduction material, that's probably the best way to go.